Antibiotics, vaccines, and other animal health technologies are critical tools that veterinarians and farmers and ranchers use to raise healthy animals. The proper use of these technologies is critical, not only for the effectiveness of the compound, but also to the overall health and well-being of the animal and safety of the dairy or meat product. The improper use of veterinary pharmaceuticals, vaccines, and other drugs in food-producing animals has the potential to leave behind residues that may be harmful to the consumer. For the purposes of this module, a residue refers to the presence of a pharmaceutical or vaccine-related compound in meat or dairy products. Antibiotics are one type of pharmaceutical administered to an animal to prevent, control, or treat disease caused by harmful bacteria. Any animal that receives antibiotic therapy cannot, by law, be sent to slaughter until the drug has been reduced to a specified level and deemed safe for human consumption. Drug concentrations above this level are illegal and known as violative residues. While the number of violative residue cases is minute, it is essential to exercise best management practices in order to prevent violative residues from entering the food chain. Viewing these videos will help you gain a better understanding of residue avoidance best management practices. What is a drug residue?
Well, drug residue is most people would think about when we treat an animal for disease or some type of illness. There is something we call a withdrawal time that follows that. And if we don't follow that withdrawal time properly, or we feed them improperly by having the wrong dosage or something, we can get something called drug residue left behind. And that's usually some kind of active drug that has not cleared the animal system yet. And so it could be a concern because it becomes part of the food supply, which we don't want.
A drug residue refers to the presence of veterinary pharmaceuticals in any edible portion of the animal product, including meat, milk, or eggs. Residues are not just limited to veterinary pharmaceuticals such as antibiotics and dewormers. Other chemicals, insecticides, vaccines, or other products given or applied to food animals can be sources of drug residues.
Some of the special concerns we have in drug residue in poultry, we have meat, and that's one that people think about a lot when we say give them an antibiotic. Antibiotics are not absorbed out of the digestive tract in general, so that when we await a withdrawal time, they should clear and there should be no product in the meat. But we have one confounding problem with poultry, and that is the egg-producing birds. We have animals that are fed feeds every single day, and they produce an egg every day. So when you think about withdrawal time, that means during that period of time, we're not allowed to consume the eggs that are produced during that withdrawal time. And that's a little bit confounding because some of those chemicals can be absorbed into fat tissue. Once it's absorbed into fat tissue at a certain degree, then it trickles out over time. So they may consume food for only a few days, but it may be 3 to 4 weeks before it clears in the egg product. That's why some drugs are approved for meat birds and some drugs are not approved for laying birds. And it's not just antibiotics. It could be warming medicines and things like that. Could be the drug. So we have that confounding factor of that hen producing a food product every day, where the broiler or turkey doesn't produce a food product until it's processed at the end.
Why are drug residues an important topic? It is the responsibility of the producer to ensure the health, safety, and well-being of their animals while remaining in compliance with state and federal laws. Following labels and abiding by withdrawal times are crucial parts in protecting our food supply chain.